Hi, my name is Kathryn Cross, and I am the founder of Anja Health, an umbilical cord blood bank. So I'm here today to demystify a lot of questions surrounding umbilical cord blood banking. But first, I'll tell you a little bit about myself. So I founded Anja Health and am involved in umbilical cord blood banking because of my brother. So his name was Andrew. I named the company after him, Anja, and he had cerebral palsy from a freak accident at a young age. So one treatment that was the most promising was umbilical cord blood stem cells. So my parents were looking into it to treat his cerebral palsy, but we were unfortunately unable to find a match. So now I'm on a mission to help convey to parents the importance of umbilical cord blood banking and how it could really save a life as it could have saved my brother's. So now moving on to the frequently asked questions. A frequently asked question is, why is it even important to bank or donate in the first place? What's the significance of umbilical cord and the blood inside of it? So essentially, the umbilical cord blood tissue, aka the cord itself, and the placenta are super rich with stem cells. Stem cells are essentially blank cells, and they can be used to replace and repair damaged cells. So as a result, anything that's damaged, whether it's skin cells, even hair cells, eye cells, brain cells, anything of that nature can be replaced with umbilical cord blood tissue and or placenta stem cells. So a lot of really frequent treatments that people have used umbilical cord blood for is cerebral palsy. It's being looked at with autism, a lot of physical injuries, sports injuries. Actually, someone on the Anja team had received a sports injury related stem cell treatment. He was a long distance runner and had a knee issues. So you can also use it for multiple sclerosis, all different types of cancers, metabolic disorders, heart disease, liver disease, diabetes, sickle cell anemia. It's being looked at for all of those. And the research there is really only going to continue to advance. So when you bank umbilical cord blood, it's not only an investment in your child's future and preventative care, but you're really building a relationship and an investment into the future of science, because science will definitely continue to open up the possibilities. Already within the past 10 years, umbilical cord blood banking has doubled in size because the science has progressed so quickly. So it's important to jump on the train while it's going. So how does it all work? Well, when you enroll with Anja, you will get our kit. Inside of our kit contains items like a blood bag, which are used for collection. So at the end, there's a needle that is used and it is inserted in the umbilical cord vein, and that's how we collect the cord blood. Then we also have different canisters and vials to collect samples of the mother's blood or the placenta or cord tissue if you're banking that as well. So you normally let a admitting nurse know if you're doing a hospital birth that you're doing collection, or you let a doula or a midwife know that you're doing collection, and normally a nurse or midwife performs the actual collection. So it's a pretty simple process. We have instructions inside, but generally providers are familiar with how to do it. So you don't necessarily need to notify your providers beforehand, but we definitely recommend it just so everyone is aware of the full birth plan. And after that, you call a number that is a 24-hour line and connected to our pickup team, and then they come anywhere in the US to pick up your collection kit and then bring it to our lab. So then our lab is able to carefully process and cryopreserve it. So one frequently asked question is definitely if you should donate or bank. So I highly recommend banking because then it will ensure that you always have access to a 100% match for your own child. Whereas if you donate and then later on you need the cord blood, then you'll have to fish through a pool of other donors and try to find someone that is your exact ethnicity. So matching happens by ethnicity. And so it's very difficult to find a match. That's a problem that I know firsthand. My brother and I are both mixed race, and if you're mixed race or a person of color, it's for sure super hard to find a match because a lot of donor pools are very white. Another frequently asked question is, can you do delayed cord clamping? So delayed cord clamping is seen as potentially beneficial because of the stem cells inside of the umbilical cord blood. So you can delay the clamping and have the baby receive those stem cells after birth. So you can do delayed cord clamping for max 2 minutes, and then you would want to reserve the rest of the stem cells for later on in life, for different types of treatments, things like that. Another common question I get is, can you just freeze it yourself? So You have to freeze it at extreme temperatures, and also you have to freeze it with vapor nitrogen in order to ensure that all of the stem cells can survive and sustain for as long as possible. So I presume you don't have access to that kind of equipment. So in general, you would need to use a company like Anja, who has a ABB accredited and FDA approved lab that's able to perform all of these very careful procedures for processing. In conclusion, if you're watching this, you are using a doula, which I congratulate you on, because I've heard amazing things about experiences with doulas and the support that they can provide to parents. And I also hope that you decide to bank umbilical cord blood and that you bank with Anja. If you bank with Anja, you can receive a discount. You can use the code GOLD. So that is going to be the Gold Coast Doula specific discount. And on top of that, you can feel free to reach out through any means, any channel. If you have any types of questions related to pregnancy or umbilical cord blood banking in general, you can head here to be able to contact us. You can text us, call, email, Instagram, DM, Facebook message, anything that suits you, we will work with. So I definitely look forward to seeing some of you there.